Hi everyone, my name is Farkanda Zahir. In today's video, I'll be discussing an article by Elsie Kajoy. The title of the article is Low Sodium Intake and Cardiovascular Disease Mortality Among Adults with Hypertension. Hypertension, commonly known as high blood pressure, is a medical condition characterized by consistently elevated blood pressure levels. Diagnosing hypertension through multiple blood pressure measurements taken on separate occasions is crucial. And once diagnosed, treatment involves a comprehensive approach that includes lifestyle modifications as well as medication. Lifestyle modifications such as adopting a healthy diet, engaging in regular physical activity, can manage hypertension. Also, medication to control blood pressure. Regular blood pressure monitoring is important to assess the effectiveness of treatment plan and make any necessary adjustments. So by actively managing hypertension, individuals can reduce the risk of complications and lead healthier lives. The author aimed to investigate the impact of low sodium intake and mortality outcomes, specifically cardiovascular disease mortality and all-cause mortality, since it's among adults with hypertension, since hypertension is highly prevalent among adults and is associated with significant morbidity and mortality. They wanted to assess whether reducing those dietary sodium intake below the recommended levels would benefit individuals with hypertension. And the study aimed to contribute to an existing knowledge on association between sodium intake and mortality. The study used a retrospective cohort design where researchers analyzed data from past data from individuals with hypertension to compare the outcomes based on sodium levels. They utilized data from National Health and Nutrition Examination Survey that was conducted by CDC, and the data set was also linked to mortality files from National Death Index. The study included 8,542 adults with hypertension, and it was representative of the US population. Participants were followed for an average of 12.7 years to assess cardiovascular disease mortality and all-cause mortality. Sodium intake levels were categorized as low or as high based on self-reported dietary intakes. The primary outcomes examined were cardiovascular disease and all-cause mortality. And these outcomes were determined based on mortality records from National Death Index. In this study, they used Cox proportional hazard regression model to analyze the impact of sodium and mortality outcomes. In this study, among those 8,542 adults, 71.01% consumed sodium higher than recommended. Over those 12.7 years of follow-up, there were 971 deaths, including 232 deaths from cardiovascular, and the individuals with low sodium intake had a non-significant 5% higher risk of cardiovascular mortality, including the factors such as age, race, and sex, and a non-significant 17% higher risk of all-cause mortality than high sodium intake group. The results indicated no significant effects by age, race, or sex, but there seemed to be an inverse association between sodium intake and mortality, so it didn't reach the statistical significance, suggesting a need further investigation. Connection to public health. Public health research, since it provides evidence for policymakers to develop and implement effective strategies, they could use this information to reduce the burden of chronic diseases like hypertension and improve overall health, population health. For example, the findings could be used to advocate for reducing sodium and in processed foods, as well as hypertension management, which is a risk factor for cardiovascular disease and stroke. So understanding those relationships can help individuals to contribute for a better management and prevention strategies. Public health campaigns. The study findings could be also utilized to design public health campaigns and educational programs targeting adults with hypertension to raise awareness for the potential impact of sodium on mortality and encourage healthier dietary choices. And although not significantly and not statistically significant, the findings suggest that further investigation is needed to comprehend a better understanding of the relationship between sodium intake, hypertension, and mortality. Some of the critiques of the article include limitations of self-report, confounding factors, generalizability, measurements of outcomes. This study relied on self-reported dietary recall, which may introduce inaccuracy and bias in assessing sodium intake. Although the study adjusted for several confounding variables, there may still be an account of factors that could influence those relationships between sodium intake and mortality outcomes. The next the next critique would be that generalizability, since the study used data from specific period, 1999 to 2010, it may not reflect the current dietary patterns and the health outcomes. The measurement of outcomes, the study relied on mortality data from National Death Index, which may have limitations in accurately capturing those causes of death and potential misclassification. So more comprehensive assessment is needed because some of the diseases, some of the cardiovascular diseases and death could strengthen the study's conclusion. And here's my references.